Welcome to Treating TMJ, a journey to a pain-free life.
Welcome to episode 4 of the TMJ and Sleep Center podcast with Dr. Insolera. I'm Randy Hawk, and let's review where we are. We've discovered that we have indications and symptoms that we may have TMJ. We've called and set up a cure consultation, and then we've moved to the measurement and evaluation process, and now we're ready to do phase 1 of our treatment plan.
Well, yeah, phase 1. Well, you'd be coming back for an appointment, and what we would be doing is to set you up for the main measuring appointment, and it's like climbing the stairway. Step 1, step 2. The first step would be we don't want you on your teeth because you've already proven that biting on your teeth puts your jaw in the wrong place, puts the muscles in the wrong place. So what we do is we fabricate a splint, and I'll tell you I don't like splints except mine, and it's a soft splint, and you put it over the teeth, and you wear it 24/7, but you don't eat with it, and it's a 2 millimeter in height thickness, and you'll wear that about a week, and then you'll come back, and we will do a 3 millimeter splint, and you'll wear that about a week, and while you're wearing that, we will have you in our office for about 2 hours, maybe more, for neuromuscular testing, and we'll also be doing a lot of cross-indexing it with the X-ray machine and showing you and demonstrating the testing and demonstrating how it corresponds with how your bones look, how your posture looks, how you look, and what we can do to offset what we're seeing, because the bad posture, of course, creates all kinds of symptomology, which is why you're there. But when we come up with our testing, we come up with an orthotic. But let me backtrack a second. The splints do another thing, because when you put a splint in your mouth, you're going to clench. And as you clench, you're going to say, well, I don't want to clench. No, it's okay to clench, because you're clenching on a 2 millimeter rise and then a 3 millimeter rise. So the jaw is actually coming down and forward a little bit. You're not on your teeth. And as you clench and you contract the muscles and then open them, contract and open, I consider my splints a vascular pump. That pump brings blood flow through the muscle, brings oxygen through the muscle, brings another little chemical called adenosine triphosphate, which is the energy bonds to propel muscle through the muscle, but it also gets rid of lactic acid. So this is a good thing. So you can be clenching all you want at this point. You're not hurting yourself. You're making the muscles move better with an increased height, which gives them better range of motion. Okay, so that's prior to...
And you can actually feel that.
Yeah. Oh.
When I was wearing my first one, I was like, wow, it feels like my jaw went to the gym.
A lot of people say they really feel a lot more secure or more strength when they close on these splints, and they feel better. Their symptomology kind of softens up and goes away. Well, not maybe goes away, but softens up and gets better, which is a nice indication, because that's just a splint.
Well, yeah, that's just a splint. And one of the things, the splint also stopped me a little bit from biting the inside of my mouth, because like you said, I wasn't going, my teeth weren't going all the way down.
Right.
So you're already feeling like, well, this is working. I'm not butting. But now looking back on that, I'm like, oh, now I see that was the setup. But at the time, I was like, wow, this is working great.
We don't want to overload the muscle too quickly. That's what the 2 and 3 millimeter does, is set the table, because if you were trying to overload the muscle too quickly, it could go into spasm, because this is muscle that doesn't have a lot of circulation through it, and it's been dysfunctioning forever, and it doesn't have a lot of tolerance. So the splints at this point are building you up so that when you indeed do get the orthotic, and the orthotic is measured neuromuscularly with what we call electromyography, or EMGs, which is how you measure muscle happiness, or you could say unhappiness. So when we do get the bite position we need, those EMGs are very low, and so they're saying, hey, this is great. And so we're getting, I'm just going to slow it down, we get an intraoral in the mouth, 3-dimensional appliance based on EMG readings. And that's what we take the impression with. And then once we get that impression, we will send it to the lab who make the orthotic. So the orthotic then, the tolerances on this orthotic are in tenths of a millimeter. You can't even see, well, I know I can't see tenths of a millimeter, but the computer can pick it up, and it's just a three-dimensional balance. So when people get the orthotic and they first put it in, and I always tell them, this is the day you should go celebrate. I don't know if you did that, Randy, but when you
my appointment was early, so I went to work.
So when you get the orthotic, and it's the first day of your life that you've been functional, and so I say for the
I
most,
do remember you say that before I left. This will be the first day that your jaw has been functioning properly.
Well, and I just include the whole individual.
Right.
But anyway, at that point in time, that orthotic now is your bodyguard. That orthotic makes sure that your muscles are always in the proper range of motion and you're recruiting properly. And as you're doing that, the orthotic is also, remember, this orthotic is in your mouth 5,000 times a day as you are awake. And so you're functioning 5,000 times a day into your neck, shoulders, back, and ribs. That is the biggest disconnect between, I guess, medical providers, because they don't realize how powerful an instrument a functional jaw can be to posture, bite, respiration. We can just keep going because it all is the same thing.
Is this an oversimplification? Because sometimes when I'm trying to explain it to people, because people are like, "What's in your mouth?" or whatever, and it's almost like your jaw is in constant mini physical therapy.
It is. That's exactly what it is. And so my thought to anybody is, who can give you 5,000 times a day worth of function? Is there any provider you know of outside of your jaw that can do this? I've spoken to neurologists, and they say they can't do what I do. Basically, because we're dealing with functional muscle, creating functional muscle, and the jaw needs to be functioning 3,000 to 5,000. Well, 3 is kind of low, but 3,000 to 5,000 times a day in order for you to live. You live your life through your face, and the body follows the head. So if your head is forward, there are consequences, and the consequences are postural consequences, respiratory consequences, digestive consequences, balance consequences, pain,
eyes,
pressure,
ears, inside your mouth, dental, yeah.
Pressure behind the eyes and ears and sides of the head, even the back of the neck, because as your head comes forward, all that weight it's a weight-bearing entity. Your neck with your head over your spine should have a curve in it. They call it a lordotic curve. When people have TMJ forever, or not even have to be forever, I had a 5-year-old with a very straight forward head neck, 5 years old, and a very extreme neck. And that creates weight bearing. Whenever the neck is straight and there's no curve, like a spring, now it's weight bearing. So the weight is on the neck, on the shoulders, the lower back, and it creates all kinds of interesting issues, sciatica issues. None of it's good. So when we start working with breathing properly, diaphragmatically, that means belly breathing, through your nose, not your mouth, and not using accessory muscles in your chest and in your neck because of your forward head, the diaphragmatic breathing isn't happening, and so the body's kicking in the muscles up here in the upper chest, which further makes the posture worse with forward head and actually creates more tension on the lower back because the head comes forward, there's more weight and pressure on that lower back.
I've been practicing the nose breathing. I'm trying to get better and better at it. When you just said it for the rest of your answer, I was over here nose breathing.
You really need to practice that, and people need to practice that with their lips closed.
Yeah.
Okay, so I do this with kids too because my son was a mouth breather, and even though he had his adenoids finally removed after I was explaining why they should be removed, he still didn't breathe through his nose because he didn't know how. So I had to show him how to do that. And basically, an easy way is to put either a poker chip or credit card that's been cleaned off, of course, between someone's lips. And so they purse their lips and hold it in place for at least 20 minutes, minimum time. And while you're doing that, breathe through your nose. Practice. What you're doing is you're creating a lip seal and making these muscles of the lips stronger, so you're less likely to open your mouth. And the brain is getting it that your lips can be closed, and yet you can still breathe through your nose.
How I got doing it longer was a recommendation from Jamie, but when I was doing my mile, I did a mile and a half. I do a mile and a half walk every night.
Oh, that's right.
And so she said, try to start out breathing through your nose, and each night make it further along your walk until you could get
absolutely
the
right.
whole walk done. So I would kind of remember, okay, I was by the mailbox with 543 on it when I had to start
Great.
breathing through my mouth. And then I just tried to make it past that one.
Yeah, I haven't seen my friend Jamie in a little bit. I did text her, and she's supposed to get back to me. That's a I totally agree with that. Because I'm into your body can improve itself, but it doesn't have to be it can't be all at once. Nobody's body works that way.
Yeah, it's not a light switch.
No, it's the consistency of continuing what you're doing to get to a certain goal. A long time ago, I'll just segue, I decided I want to run a marathon. Okay, well, you're not going to run 26 miles just because you decided. So I researched it a bit, and I was always working out or trying to keep fit. But it's a series. I mean, I remember race walking first, a couple of miles, 3 miles, whatever, and then I started incorporating jogging for a certain amount, race walk, jogging, race, and then eventually it was all jogging. And then from 3 miles, 5 miles, I remember when I did a 10K, 6 miles, I'm like 6.2, and I couldn't believe how happy I was, or believe that I could even do it. And you just keep going.
Right, and you have to start. I was interviewing, this is years ago, 1998, I believe. I was interviewing a little girl who had leukemia, and she was looking to raise money by getting somebody to run a marathon. They had a marathon in San Diego that was designed to be a fundraiser. So I was interviewing on the radio, and I went, well, she's like, I just need somebody to run it for me. And I was like, well, I'll do that. So I got off the radio, and everybody's like, do you know you just volunteered to run a marathon? I'm like, yeah. And so, I was in a panic. I was living in Green Bay at the time. It was January, and the marathon was in like July or August in San Diego.
Oh, you had time.
So I went and got a trainer and did the whole program.
So you
and
did
stuff
a marathon,
like that. Yeah, and
I
was training for the
you.
marathon in minus 10 degrees in Green Bay, and it was unfortunately warm in San Diego, 92 the day that I ran the marathon.
Well, they did it real early, though.
But I do like that. My point on saying I did it as well is I now tying what you just said into understanding how you had to lay out the grid to train like you did and I did for the marathon. If you really look at this is the first part. This phase 1 is the first part of wanting to run a marathon. So I love that analogy.
Absolutely. Great. That's awesome. I mean, you can't get any better than that. Yeah, that's exactly what it is. It's a journey, and it's a journey with, you just have to work your way through it and be consistent.
You have to run 1 mile before you can run 26.2.
Oh my God, absolutely. But I got so addicted, then I ran 7 more. So
that didn't happen to me.
Well, it was just something, I enjoyed. And I did come from New York, and so my first marathon was New York.
Oh, wow.
So that's with 30,000 people. So it's an interesting running with 30,000 people.
Right.
So I did 5 New Yorks at one point when I finished. I haven't done a marathon in years, but I still work out every day, just not to run a marathon. But if you think about a marathon, see, I really broke it down. A marathon is 43,000 strides on asphalt.
Oh, wow. Okay.
Guess what gives? Not asphalt.
Right.
So you better be sure that your knees, your hips, everything is, I used to do a lot of weight work for the legs, presses, squats, things like that, as well as develop shoulders and abs because they take a beating.
Right.
They take a beating.
Right. And just everybody listening, we will make sure we have examples of the splint and the orthotic and things like that on the podcast page so you can see what we're discussing.
Yeah, and orthotic isn't visible in your mouth. A lot of people are worried about that, or it might be a little bit visible, but it's clear and it's over the lower teeth, and it makes sure that your jaw's in the right place, and you just have to adapt to it.
Mine sits right behind it. Nobody even.
Yeah, I don't ever have anybody ask me.
What I also like about it is it stays in there firm. So even if you want to be one of these people,
sure.
I remember when I had a retainer when I was a kid, I always would flip it out with my tongue and spend most of my time playing around with it and ruining it. This doesn't go anywhere when you get it locked in there. You
can do that. And I sometimes talk about kids because when we do orthopedic work on the children, which is the same thing as TMJ as in adults, because we're bringing the jaw to the optimum position so they grow properly, breathe properly, things like that. The parents will sometimes say, Dr. Paul, can you make this tighter on my son or daughter? I said, why? Because they play with it. And I said, let me ask you a question. When they're eating, does it stay in? Are they okay with eating with it? Then they say, yeah. I said, let them be. I don't care if they play with it, as long as it's in place when they eat.
Right.
That's the key.
That's when they're going to get the most reps on their jaw.
That is the key. Yeah.
So we've now got the splint, wore both versions of it,
And now you have an orthotic.
and now we have an orthotic.
And now I told you to go celebrate.
Right.
So now you are on a 4-month, I don't want to say treadmill. Well, you could say treadmill. Or you're in 4 months. What's going to happen in 4 months? We're going to check you at least every 4 weeks. We're going to check your bite because your bite's going to change. We're going to adjust for that. We're going to check your posture because you should be doing your postural therapy because that's going to change. And every time you come in, you'll fill out a form. It's a quick form. You just check the boxes as to what you're doing for posture, what you're doing. Right. Any concerns, and we need to see that, and we'll be measuring your range of motion with your mouth, and we'll also be looking at your posture. And about 2 to 3 months in, we'll be taking another x-ray of your neck and comparing that with the first x-ray. There should be a considerable difference. If there isn't, then posturally, we might have had a hint of it beforehand, because if what you're doing is not working, we need to keep abreast of everything because it should work. The groundwork is laid by the orthotic, which makes everything possible. So you're not getting the bad feed from the mouth 5,000 times a day into the posture. And so anything you're doing for posture to create strength between your shoulder blades, strength in your upper chest, to bring your head over your spine, nose breathing, so you're not mouth breathing. These are the things that work. There's lots of different avenues to follow. People do different things, but the point is, in 4 months, we should see a considerable difference in posture and bite, and your reward is a second orthotic.
Right.
That is the reward, because the bite is so significantly changed from when you first came here, and you're not the same person you were. We just had a person in yesterday. He just retired, but I've been working with him. And when he first came to us, he opened 30 millimeters. 30 millimeters is not normal.
Not far, no.
45, 55. And so now it's 4 months later. He's going to a second orthotic because he opens 57 millimeters.
Wow.
And his posture's changed. We still need a little more.
I think he's got like a 2 centimeter lead on me. Better do an extra yoga class.
Well, I got to tell you, we get some people, they open over 60. And I explained, you don't need to open that wide, but I appreciate you doing it for me. We'll record it. But
and it's not only the measurement for me, it's the lack of pain or snapping that I noticed before I could open further.
And you open actually a little bit more quicker because you're not thinking you're going to get jabbed with some pain.
Oh, I didn't think about that.
Yeah, so
that makes sense.
People sometimes hesitate and their eyes kind of close a little bit and they go about midway and the jaw might shift a little bit and then they'll go again. I mean, these are people that are encumbered by adhesions, by the jaw being in the wrong place. Once we get that position established and you're working that position, that won't be there anymore. They'll open straight and assured that they're not going to have that problem.
Yeah, because my left side was way cloudy on the X-ray.
Well, the cloudy part is what we call remodeling because it's been there for so long. The bone changes because of the stimulus that it's given, and it's an improper one, unfortunately, a dysfunctional one. So as we get the orthotic working its magic, that stimulus changes, and the muscles clean up their adhesions so they can open smoothly, and they can open efficiently, and they can open in a greater range of motion, which is what we want. But that's what any physical therapist worth their salt would want to do with your posture. Make sure that these muscles, which were tight and sore and painful, you're creating an environment where they're not going to be that way anymore.
And would you say this is kind of the heart of the treatment? You've worked towards getting after the second splint, you get the first orthotic, do that 4 months or so, get the second orthotic, do that 4 months or so.
Yep.
That is really the heart of where the change starts to, the transformation begins.
Well, the biggest change is the first 4 months, and that's the biggest bite change. And then we're tweaking the bite over the next 3 or 4 months because we do have a phase 2, which we'll get into at some point.
Right.
But by that second orthotic, we've talked about phase 2 prior to it, but we'll be talking about it we start really mapping out what we might want to do phase 2 wise. So the person is comfortable with what we're going to do next. And they've had time to think about it, so that if there's anything that they need to make a decision about, they'll have time to think about it. We don't rush anybody into that.
Right.
So.
And looking ahead, we've mentioned a few times in this podcast about the physical therapy part of it.
Yep.
It's a really cool component, and it's nothing to be afraid of.
No, the physical therapy is great, and what we were just mentioning, Jamie, she's really good, and you've got to be able to understand muscle. I mean, a lot of physical therapists do. Don't get me wrong, but I like to intercede with them and talk to them so that the patient is comfortable, the physical therapist is comfortable with what I want. A lot of times, we'll send the patient with X-rays to the physical therapist so they see exactly what I see.
That's what you did with me. I had pictures of them on my phone. I took pictures from your screen and took them over.
I also could give it to you in an envelope that I would have given to. In this case,
I'd have lost that.
That's true. You actually, the phone might be a really good idea. So they'll take the picture on the screen and then give and let her see that. But that really explains. I think we're working from neck up, but the neck up controls the neck down as well, because the body does follow the head. So, and
we're going to get into a full podcast about the physical therapy component in future podcasts. So that's a teaser. And we'll also get into phase 2 in a future podcast. So now we on your journey to better functionality and better function of your jaw is we've gone through the splint and the orthotic.
The thing I like to leave the patient with is, just even the new patient exam, you have to assess if what we're going to do is going to work. It will work if you are totally into it, because you got to be into curing yourself. What is it worth not to have pain? What is it worth not to have your symptoms anymore? Not having to take pills anymore, or be incapacitated or limiting your lifestyle? What's it worth? I can't assess that. So I would never make a decision for a patient to tell them what to do. I just ask them to make the decision and decide, what is it worth? If it's worth it, we're here for you.
Having the orthotic, eating with the orthotic in my mouth is much more enjoyable to me than not being able to eat certain things, because I've bit the side of my mouth so badly so many times that it hurts, it burns when I eat certain foods stuff. So I found it more enjoyable.
And a lot of people can't eat harder foods because their joints hurt, because it's painful back there. The joints are remodeling, they're bruised, and the jawbones are not in the right place. But with an orthotic in your mouth, that all goes away, because the orthotic's your bodyguard. It's putting it in the right place. You can't hurt your jaw. You can't hurt your muscles. The more you use them, the better you get. So that's the good news.
Perfect. And we'll put photos and miniature videos for deeper dives into everything we've discussed on this podcast. And also in the future, we'll go do some phase 2 items, as well as the physical therapy and more. Thanks for listening to the TMJ and Sleep Center podcast with Dr. Insolera.
Thank you.